Dr. Amanda Tinkelman. I'm a psychiatrist, the physician in charge of the perinatal center at the Zucker Hillside Hospital. Stress and mental health affect the heart both through physiological as well as behavioral mechanisms. Physically, stress triggers the release of hormones such as cortisol and epinephrine, which can increase heart rate, increase blood pressure, which are adaptive, good responses to stress in the short term. But when stress is chronic and long-term, that elevated cortisol can result in increases in inflammation, which can increase risk for cardiovascular disease such as atherosclerosis, and can also increase risk for autoimmune disease, especially so in women. Mental health also can affect cardiac health via behavioral mechanisms. So, for example, when someone has depression or anxiety, they're more likely to socially isolate. Loneliness is a risk factor for cardiovascular disease, especially later in life. It's also more likely to disrupt their healthy habits, so good sleep cycles, healthy eating, exercise. People are more likely to have unhealthy coping mechanisms when they're depressed or anxious, such as addiction, smoking, drinking, things like that, and all of those can negatively affect cardiac health. How much time do we have? Women have many unique stressors, and I guess I'll start with societal pressures. Women have pressure to have certain personality traits, such as being agreeable, being caretakers, being non-confrontational, non-disruptive, and simultaneously are burdened with a disproportionate amount of work in the home, while still expected to do the same work in their career. Given our culture's lack of adequate support for childcare and family building, this puts a lot of additional burden on women, in particular mothers, but not just mothers, women in general, caretaking either children or older family members, as well as maintaining the home to a much larger degree while also pursuing a career. In addition, there's increased risk of violence against women, including sexual violence, decreased autonomy in medical decision-making. Yes, especially so at certain times during the lifespan, especially so during times of hormonal transition. So women who have gestational diabetes or preeclampsia, high blood pressure during pregnancy are at increased likelihood of having cardiovascular disease later in life. And women after menopause, as estrogen drops, are also at increased risk for cardiovascular disease because of the loss of the protective effects of estrogen. I would say definitely. In addition to normalizing discussion of these topics, which decreases stigma, it also can help provide tailored interventions to help reduce the stress that each individual person might be facing, either through referral to support programs or mental health treatment. It usually looks like a series of questions. The most common ones are either 2 questions or 9 questions that ask about common symptoms of depression and ask the person how frequently or how severely they are experiencing those, and ends with a score, which then can lead to either a positive screen or a negative screen, but gives you a sense of how much of those depressive symptoms they're experiencing over the last few weeks. Some tools and tactics that I'd like to see my patients use include self-compassion, finding community, focusing on their own health and well-being, including adequate sleep and nutrition, exercise, especially somatic exercise, and some sort of a creative outlet for self-expression, especially important for people who tend to self-suppress. Self-compassion, I find that many people are especially hard on themselves and have internalized a lot of the expectations that the culture expects of them, which are impossible to achieve. And we all know that they're impossible to achieve, and if we applied them to anyone else in our lives, we would reasonably conclude that that person is doing great, and it's impossible to probably do much better. But when we apply them to ourselves, we're often extremely self-critical. So one technique that some people use and find effective is imagine that they were speaking to a friend or speaking to their daughter rather than speaking to themselves. And that tends to promote a lot more realistic expectations and self-compassion than the usual self-talk that goes on in our own minds. Yeah, I think being proactive is the best course, because once there's a red flag physically, often that's already far enough along in the process that there's already been damage to that person's health and risk factors that then would be difficult to reverse. Once somebody is experiencing symptoms of cardiovascular disease, especially for women, they might be more likely misdiagnosed. They're not often the same presenting symptoms as men experience, and therefore often are misdiagnosed and not treated as quickly or as effectively.